हेलो गुड मॉर्निंग, मैं से डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के पास्ट ईयर क्वेश्चन पेपर। अ 45-year-old मैन प्रेजेंट टू द ओपीडी with symptoms of headache, renal stones and abdominal pain. Serum calcium is low and PTH is high. Which of the following hormones and associated disease might be causing these symptoms? See here the low calcium level and elevated PTH levels indicate mineral and bone disorder. What do they indicate? Mineral and bone disorder. In chronic kidney disease, mineral and bone disorder (CKD) and MBD, essential changes, uh, essential changes encompasses the hyperphosphatemia and hypocalcemia, deficient serum vitamin D levels, and heightening the secretion of the parathyroid hormone (PTH), culminating are in the secondary hyperparathyroidism. Here the answer is the mineral and bone disease. Next question. A 45-year-old man present to the OPD with proximal muscle weakness, purple stretch marks, obesity, and easy bruising. What is the underlying condition? Here the project scenario suggesting a Cushing syndrome with feature like inconsistent weight gain, purple stretch, and proximal myopathy, hypercorticolism. Here the answer is the underlying conditions in Cushing syndrome. It's primarily caused by the chronic overproduction of cortisol by adrenal gland. It is often due to the adrenal and pituitary tumors. Pituitary dependent cortisol excess, termed Cushing disease, account for about the 18% of cases in Cushing syndrome. Next question. All of the following are criteria for diagnosis of diabetes ketoacidosis except serum glucose of more than 250, anion GABA more than 10 to 12, serum bicarbonate less than 15, and serum potassium less than 3.5 mQ. Except then here serum potassium less than 3.5 mQ, because serum potassium is below the 3.5 mQ can occur in diabetic ketoacidosis but is not part of the diagnostic criteria in DKA. In DK patient are often potassium depleted, yet plasma potassium level may not fully indicate a total deficient. Initially level might be elevated due to factors like water loss and potassium shifting. However, the treatment can lead to a rapid drop in plasma protein due to the fluid dilution, insulin-induced movement into the cell, and ongoing the renal loss also can occur. Next question. Which of the following test is the best for accessing long-term control of diabetes mellitus? Glycosylated hemoglobin, glycolated albumin, serum fructosamine, urine sugar. Long-term control of diabetes mellitus is the glycosylated hemoglobin. The test is mostly developed for the evaluating the long-term glucose control in individual with diabetes. It measures the percentage of hemoglobin that is glycosylated, reflecting average blood glucose levels over the past 2 to 3 months. Next question. Which of the following is the diagnostic test for carcinoid tumors? 24 hours unique at coal serum calcitonin level, serum chromogranin A, urinary 5-hydroxyl 5-hydroxyindoleacetic acid. Here the answer is the urinary 5-hydroxyindoleacetic acid. Carcinoid tumors are neuroendocrine tumors that secrete serotonin. Serotonin is metabolized into a 5-HIAA, which is excreted in the urine. Elevated levels of 5-HIAA in a 24 hours urine sample are indicative of a carcinoid tumor. Next question. A patient present with hypotension, hyponatremia, and blackening of the knuckles and Preanal area. Which of the following conditions is most likely associated with these symptoms? Cone syndrome, Cushing syndrome, primary STH, and Addison disease. The correct option is the Addison disease because the symptoms hypotension, hyponatremia, hyperpigmentation. In the hyperpigmentation are characteristic by darkening of the skin, including knuckles and perineal areas, due to the increased ACTH levels stimulating melanocyte. In hypotension, due to insufficient cortisol production, affected blood pressure. If a hyponatremia caused by the low aldosterone level, leading to a reduced sodium resorption. Next question. A patient with a history of Wilson disease presented with neurological manifestation. The following is the best diagnostic modality: serum seroplasmic urinary copper excretion, hepatic parenchymal demonstration of copper, anti-tissue transglutaminase antibody. Here the correct option is option C, hepatic parenchymal demonstration of copper. Wilson disease is a genetic disorder characteristic by the excessive accumulation of copper in various body tissue, primarily the liver and brain. The best diagnostic modality to confirm the Wilson disease, especially in the presence of the neurological manifestation, is a hepatic parenchymal demonstration of copper. This is usually done by performing a liver biopsy to measure the hepatic copper concentration, which is considered the gold standard for the diagnosis. Next question. Patient present with large sweaty hand, macroglossia, and a frontal bossing for confirmation of the diagnosis: G and RH level, IGF first, IGF2, GH levels after glucose suppression. Here the confirmation of the diagnosis is the IGF first. The best because of the best test for the confirming a diagnosis of the acromegaly often caused by acromegaly is often caused by the excess growth hormone is measured insulin like growth factor first. Levels are elevated in acromegaly due to the increased secretion of growth hormone. IGF first is a stable marker that IGF first is a stable marker because that reflects the chronic exposure, exposure and and growth hormone and is therefore more reliable for diagnosis compared to intermittent measurement of growth hormone. Thank you and keep revising.